Thank you. Face gender abolitionist comrade. Breaker Pooh has discovered the truth about gender-affirming care. Let's find out.
If I told you that I advocate for the chemical castration, sterilization, and physical mutilation of children and young adults.
All right, we are already off to deeply, deeply misrepresenting gender-affirming care. When they're saying chemical castration, they're using that to refer to puberty blockers. Sterilization, they're referring to puberty blockers, which as soon as you go off of them, you can become fertile again. That's just how it works. We saw, even in the peer-reviewed study, even if you go on cross-sex hormones, you still can regain fertility after going off of them for 3 to 17 months. In every case in this peer-reviewed study, they were able to regain fertility. Already lying. And physical mutilation would apply to literally any surgery or any kind of like medical treatment. Open heart surgery. Oh, they're mutilating someone's heart. The loaded language is extreme. And, oh yeah, you know that the conservatives that fearmonger about gender-affirming treatment that is desired by trans teenagers, trans adults, they're gonna call it mutilation. Despite not calling mutilation things like circumcision, things like intersex genital surgeries, which are completely unnecessary. Loaded language right off the bat.
Anyone under the legal age of consent. My guess is that you would consider me a crazy person, a monster, or worse.
A crazy person, a monster, or worse? That entirely applies to circumcision. Yet conservatives really don't, like, conservatives don't care about circumcision. They're totally fine with it. I guess she's a crazy person, a monster, or worse, already.
But that's exactly what activists, medical professionals, and progressives who promote and defend gender-affirming care do advocate.
No, it's not any of that.
The problem for these gender ideologues, of course, is while it is possible to identify as anything, it is not possible for a man to be a woman or a woman to be a man.
Whoa, okay. I think that they're first off conflating sex and gender. They're gonna say that you have to, regardless of your identity or you know, if you socially transition, then you're never gonna be the other sex or are exactly identical to the other sex. Yeah, this is just based off of a fundamental misunderstanding of the difference between sex and gender. Sex is biological, gender is social and cultural. Gender is assigned by society, is assigned by an individual to themselves, particularly their psychological identity. When a trans person is saying that they're a woman, or a trans man is saying that they're a man, they're doing so in the same way that an adoptive mother says that they're a mother, or an adoptive father says that they're a father. They're saying that they're fulfilling the social utility of motherhood, not that they did so out of a biological basis. PragerU is not even going to engage with that idea. They have to pretend that sex and gender are the same thing in order for them to make any of the arguments they're going to make in this video.
To obscure this fact, activists have manufactured a small dictionary of sweet-sounding terms like transgender.
We manufactured the trans dictionary so that we would yield to our validity. So first off, all words are made up. All words are manufactured. It's good to have words to describe phenomenon, like transgender, to describe people whose gender identity differs from the gender they were assigned at birth. It's good to have a word to refer to. So, okay, so suppose we live in the world where we didn't come up with the term transgender. How would you even make this video? How would you even describe trans people? There wouldn't be an objective language to describe them. We come up with terms to describe things. PragerU's getting mad about that. That's literally what they're getting upset with.
Gender fluidity.
Oh, gender fluidity. Gotta drink the gender fluid.
Non-binary.
Correct. All of these terms are made up, as are all terms, to describe various phenomena and identities. That's just how terms work.
Gender-affirming care is the phrase activists have coined to describe sex change treatments.
What?
Puberty blockers, hormonal injections, and double mastectomies.
Puberty blockers do not change your sex. So much of what is considered gender-affirming care does not change your sex. Once again, they're conflating sex and gender, like all of their arguments are going to. So, if you take a puberty blocker, it's just going to pause your puberty. That does not change your sex. A double mastectomy, that does not change your sex. That just removes a body part. Hormonal injections, those can change your hormonal sex. I think that calling it like a sex change treatment is quite a bit extreme, because when people invoke the phrase sex change treatment, they're trying to give you an image of like surgeons like performing bottom surgery. We're talking about hormones. Also, just calling all hormonal injections as sex change treatments, like if a cis man is prescribed testosterone or a cis woman is prescribed estrogen, is that a sex change treatment? So gender-affirming care encompasses things like gender therapy, or like allowing a teenager to express themselves with like a different name or pronouns, or like wearing their hair long, wearing a certain style of clothing that they like. That's considered a gender-affirming treatment, a social transition, which has been approved by like doctors. Doctors say, hey, yeah, I think you should totally socially transition. Seems like that's what you want and you benefit from that. To call all of gender-affirming care sex change treatments is so misleading and factually incorrect on so many of these.
Shockingly, children's hospitals are big players in this game.
Yes, if you are going to treat transgender children, children's hospitals do generally treat children. That is true. Children's hospitals treat children. It's because there are research-backed established medical guidelines which establish how to medically care for children, and children's hospitals follow those. That is true.
The Boston Children's Hospital's website has posted videos in which its doctors describe a full menu of medical treatments, including hysterectomies for gender-confused teens.
This is the exact lie which got bomb threats called at the Boston Children's Hospital. So there was a video where the Boston Children's Hospital was talking about various gender-affirming treatments which they provide. Most of these treatments, they only provide to adults. One of the options is Boston Children's Hospital. They also do treat adults. They don't only treat children. They allow people to who are adults to receive hysterectomies, a removal of the uterus. And for some transmasculine individuals, it can be gender-affirming to not have a uterus anymore, no longer have periods, no longer be able to get pregnant. This can be a gender-affirming procedure. When they were describing gender-affirming procedures, which they allow adults to opt into via informed consent, doctor's letters, therapist letters, that kind of stuff, they described it hysterectomies. Matt Walsh and a bunch of other reactionary right-wing sources blew this up and lied, saying that they were performing hysterectomies on minors, which ended up resulting in bomb threats being called into Boston Children's Hospital. They just perpetuated the exact same lie, which caused bomb threats to be called into Boston Children's Hospital. We are 1 minute in, and we are repeating the lie which resulted in bomb threats. Thank you, PragerU.
The gender clinic at the Barbara Bush Children's Hospital in Maine offers instructions to boys on how to tuck their boy parts to make them look more like girl parts.
Oh no, don't let the conservatives know about tucking. So the idea of tucking, you just like essentially turn your penis back. You're going for a really intense tuck. Essentially it creates what looks equivalent to a pussy mound. This is how, if you ever seen like pictures of trans women in bikinis where there's no dick bulge, they do that. They just like tuck the penis back. Trans people are going to tuck if that's something they want to. And if a hospital can provide instructions on how to safely tuck, that's not a bad thing. Fear-mongering about tucking, which is the funniest thing ever. How is it harmful for somebody to tuck? And also, if you do think that tucking can be harmful, wouldn't you want doctors to instruct people on how to do it safely? Which is what happened here. Crazy stuff. Crazy stuff.
Yale University's pediatric gender program director has said she's medically assisted children as young as 3 years old on their gender journey.
Oh my goodness. Okay. So when they're talking about medically assisted, they're trying to invoke an image that Big Trans over at Yale is performing bottom surgery on this 3-year-old child, when what actually happened is they got gender therapy. Like, this person is a therapist who helped kids talk about their gender identity, and they're trying to make it sound like they gave a 3-year-old bottom surgery. PragerU is so dishonest. They will take gender therapy and then use manipulative language to make it sound like the liberal media is coming for your penis.
Vanderbilt University Medical Center has assessed gender care to be a new profit center. One of its doctors explained why. Attempting to change someone's sex creates a permanent patient. Knowing patients will have to return.
Are you telling me that in a capitalist society, medicine makes profit? Are you telling me that Big Pharma profits off of insulin? Profits off of cancer treatments? Profits off of literally everything? I'm sure conservatives are completely genuine in their concerns about Big Pharma profit, and that conservatives would do everything they can to nationalize the pharmaceutical industry, for instance. That conservatives would never do things like funnel money into big corporations and Big Pharma, except that's what they always do. These concerns are completely disingenuous, and we can make this exact same criticism about literally every medicine. Even cancer treatments are profitable. Actually, even like the hair transplant industry is more profitable than trans medicine. You can look that up. It
is a guaranteed moneymaker. Even the American...
Oh my gosh, they're trying to say that, okay, having to take hormones the rest of your life is like so much money for Big Pharma. Hormones are cheap, even with just like a good RX coupon. It's like $10-15 a month. It's cheaper than insulin, which is something that people are pretty satisfied to take for the rest of their life, for example. Is this PragerU's critique of capitalism? They are indeed critiquing capitalism, but they're going to make the audience think that they're critiquing trans people when they're actually critiquing capitalism. It's a very clever deception.
American Academy of Pediatrics has
Oh yeah, and obviously they had to give the trans woman a beard so that you knew she was a trans woman. Thank you, PragerU.
endorsed the medical and chemical treatment of gender-confused children.
Once again, we're using some very loaded language, but medical treatment would refer to gender therapy, talking to a therapist. Chemical treatment would refer to puberty blockers. Those are indeed chemicals. Yes, it is true that we prescribe puberty blockers to people who are around the onset of puberty. It would not make sense to block our puberty after it's already been completed. That's not the critical period when puberty blockers would even function. Yes, it is true that we provide puberty blockers to people who are trying to block puberty. Big shock.
When some members asked for a more critical look at affirmative care, they were immediately shut down, accused of being transphobic.
Okay. Are we gonna give any more detail about that? Can we see what they said?
When some members asked for a more critical look at affirmative care, they were immediately shut down.
When some members of what? American Academy of Pediatrics, more critical approach. Let's see. Can we get something that has the word transphobic in that? Or did they just make up the accusation of transphobia? Yeah, I can't see anything from the American Academy of Pediatrics itself. Seems like it's not something that they actually did. Don't think that what they said actually happened. There's not a source of the American the American Academy of Pediatrics labeling people as transphobic for questioning their approach. That doesn't seem to have happened. I think that there are certainly ways that people could have phrased those criticisms, which absolutely could be labeled as transphobic. Like, for example, if they said something along the lines of, transgender people don't exist, why would you treat this population? Yeah, that'd be pretty transphobic. It would all depend on what was actually said, if anything was actually said at all, which I can't seem to find a source.
Pediatrics Academy did not stop there. It teamed up with the American Medical Association and the Children's Hospital Association to petition the Justice Department to suppress anyone on social media who opposes their pro-gender treatment position.
That also sounds completely made up. American Medical Association. Here's something from the American Medical Association. All right, what do they actually ask for? The group sent a letter to Attorney General to investigate the increasing threats of violence against physicians, hospitals, and families of children providing and seeking evidence-based gender-affirming care. Was this about the bomb threats that PragerU spread the exact same misinformation which caused the bomb threats? We cannot stand by as threats of violence against our members and their patients proliferate with little consequences. We call on the Department of Justice to investigate these attacks on social media platforms to reduce the spread of misinformation enabling them. Yo! They're literally calling for the investigation of the lies, such as the lie that Boston Children's Hospital was performing hysterectomies on minors. These lies which caused bomb threats. Let's see how they framed that.
Association and the Children's Hospital Association to petition the Justice Department to suppress anyone on social media who opposes their pro-gender treatment position.
Suppress anybody who opposes their pro-gender affirming treatment position is not the same thing as telling the DOJ to investigate people who are spreading lies which have led to bomb threats. Holy dishonesty. That is the most dishonest framing. The most dishonest framing, yeah. That is absolutely insane. That is unhinged posting.
While the American medical establishment speeds toward the affirmative care cliff, other countries are hitting the brakes. The United Kingdom has shuttered its state-run Tavistock Gender Identity Clinic, which was the largest pediatric gender clinic in the world.
So are we going to explain why they shut it down? It wasn't due to, like, research which had come out that showed that their results weren't effective. It was due to conservative outrage. It was conservative fear-mongering, conservative politicians which shut it down. Is it woke to be against terrorism now? It would seem so. It would seem so indeed.
After a report found that its patients were at considerable risk due to its unquestioning affirmative approach.
That didn't happen. It was conservatives fear-mongering. They didn't have any evidence. Are they going to say the affirmative approach is bad?
A more accurate description for this approach would be medical malpractice.
Okay, let's talk about the affirmative approach and why it is not medical malpractice. The affirmative approach is what is backed by all of the available research and medical guidelines we have. The reason why is that it seems to be the case that when you are helping a teenager or an adult explore their gender identity, know about their options, figure out what's right for them, it is a bad idea to just flat out tell them, no, you're not trans, you're not this gender, you're wrong, stop it, stop thinking that. This is true about medicine in general. For example, if a patient comes to a therapist and they say, I'm having depressive thoughts, what the therapist would want to do is be like, I believe you. I'm really sorry to hear that you're having these depressive thoughts. Let's talk about that. Maybe you have clinical depression, and if that's the case, there's perhaps medicine, therapy we can do to help you. You're not supposed to say, no, you're not depressed. Sorry, suck it up. You're just going to be a happy person, and you're not depressed, so stop thinking that. That just is not good therapy. It doesn't help people. Similarly, if somebody comes to a gender clinic and they're like, hey, I think I'm a girl, then the best thing they can do is be like, that's awesome. I believe you. You go, girl. Yeah, let's explore your options, talk about why you're feeling this, if transition would be right for you, all this kind of stuff. They want to investigate the why and investigate what they can do to help you. Denying what somebody comes to you with is just not good therapy. You want to help somebody explore themselves. That's the best kind of therapy you can do. That's why the affirmative model is working.
In no other part of the medical world is it considered acceptable or even legal to damage the body of a healthy person irreversibly.
Circumcision, intersectional mutilation, literally any surgery which has a recovery period. What are they talking about? They're just lying.
If a mentally ill man who identifies as an amputee asks a doctor to amputate his perfectly functioning arm to match his identity, every self-respecting surgeon will send him away.
Why would the doctor not do that? And also, the doctor would not just send him away. The doctor would attempt to perform what is known as sensory education therapy. Big surprise, gender dysphoria and body identity integrity disorder are very different medical conditions which have very different medical treatments which help them. What the doctor's goal is to reduce harm, is to improve patients' health. For people with body identity integrity disorder, it seems that sensory education therapy is the most effective option we have for helping them feel a congruence with their body. For transgender people, it seems that medical transition and social transition is the best option we have for helping them feel congruence with their body, for improving their mental health. Doctors and therapists recognize that different medical conditions have different treatments, and that's why they do research to figure out which treatments are most effective. Those are the treatments that they establish based off of research and medical guidelines, which they follow. So the medical guideline for body identity integrity disorder is different than the medical guideline for gender dysphoria. Big surprise.
If a young girl suffering from anorexia walks into a hospital and asks for liposuction, no one in their right mind would grant her request.
Anorexia and gender dysphoria are different medical conditions which have different treatments. What is so hard to understand about this?
And that's because physicians swear an oath to do no harm, to preserve and protect and heal a person's body as best as they can, in spite of any delusions the person may be experiencing.
That's not the Hippocratic Oath. They edited the Hippocratic Oath. Hold up. Pretty sure it doesn't say anything about delusions. To the best of my ability and judgment. Okay. Yeah, the phrase delusion doesn't appear in here anywhere. Warmth, sympathy, and understanding may outweigh the surgeon's knife or the chemist's drug. I will be not ashamed to say I know not. Oh, PragerU would never say I know not. Yes, they added the line about delusions to try to imply that trans people are delusional. Also, yeah, it does not explicitly say do no harm. It's more so about reducing harm as much as possible. Applying for the benefit, all measures required. It doesn't even have the phrase do no harm. Like, this is like a folklore of the Hippocratic Oath. If the phrase was like, you can never do any harm, every surgery in existence has a certain regret rate, how could you do any surgery? It's about doing the least harm possible, doing the most good possible, easing as much suffering as you can. It can't be a perfect process. Every surgery is going to have a regret rate. For example, trans surgeries have astronomically lower regret rates than most surgeries. The regret rates for trans surgeries range between a fraction of a percent to 2% at most, and then most surgeries have regret rates around 4, 5, up to like 20% even. This is just another lie.
And yet doctors violate that oath every time they promote gender-affirming care.
Are you saying they violate the Hippocratic Oath, or they violate the oath that you made up, PragerU? With the oath that PragerU made up, trying to like treat somebody with knee replacement surgery, which has a 20% regret rate, would be doing harm 20% of the time. This is just so frustratingly deceptive.
Their motives, no matter how compassionate they might sound, are not relevant.
So now PragerU is saying we should not judge their actions by their intent. We should judge their actions by their consequences. I agree with the consequentialist framework. Let's actually look at the medical outcomes of gender-affirming treatment. Every major medical institution supports gender-affirming medical treatment because it improves the mental health of trans people. That is the outcome. If you're going to argue for a consequentialist model, that's why they do it. They do believe in the consequentialist model. And that's why they do gender-affirming treatment, because it has positive consequences. Actually, a good argument from PragerU, but they're about to lie. Let's see the lie.
The idea that teenagers, let alone small children, are capable of making such life-altering decisions is not only brand new, it's absurd.
They just said you have to assess things by their consequences. They're not using any consequential evidence to justify whether or not a teenager has the capacity for medical consent. They're making an argument based off of kind of like an ontological idea, not a consequential idea. They just contradicted the consequential framework they just put forth. From a philosophical perspective, they literally just contradict themselves. I'm sure PragerU's audience is too stupid to notice the contradiction. And also, teenagers do consent to medical treatment all the time, with the help of doctors and therapists. Things like antidepressants, ADHD meds. Teens get on these medications because with doctors and therapists, they can determine that, yes, this is right for them. Yeah, they are conflating sexual consent with medical consent. Every conservative that argues against trans people seems to do.
A society that allows them to do so is deeply broken.
A society which allows a teenager to go to a therapist and the therapist can prescribe them antidepressants or ADHD meds because they have depression or ADHD. Deeply broken. Wow. Just like literally think about this with any other condition and it's intuitively so clear how wrong PragerU is.
How do we put an end to this horror?
That's pretty yikesy rhetoric.
First, we need to stop going along with the language games gender ideologues want us to play.
We have to burn the gender dictionary. You cannot use the term transgender anymore. They came up with words like transgender. You have to stop playing along and stop using the word transgender.
There are men and women and boys and girls. And there are men and women and boys and girls who are confused or deluded about which one they are.
That's pretty yikesy if you take into account literally any kind of cultural context, like the Hijra people of India. The Hijras are a different third gender, which are socially and legally recognized in India, for example. I guess according to PragerU, they're just deluded. Oh, this is so completely falsifiable. As soon as you look at literally any other culture. We can talk about the Two-Spirit populations of Native Americans. There was the Mahu of Native Hawaiian tribes, for example. So many different constructions of gender. Even the ancient Jewish societies described in the Tanakh, they legally and socially recognized 6 genders, not 2. Even if we're getting into like older Judaic texts, they did not recognize 2 genders. They recognized 6. But I guess ancient Jewish societies were just deluded or something.
There is no such thing as having a place on a gender spectrum.
Do they mean us? Okay. So PragerU has been conflating sex and gender throughout this entire video. They're talking about there's no such thing as like a sex spectrum. Intersex people literally exist. Also, the various constructions of gender across different societies and cultures literally paint a spectrum, even just descriptively speaking about social roles, not even talking about identity, which obviously exists along a spectrum.
With the rarest exceptions, we are born one of 2 sexes.
That's a spectrum. Even if like most of the time you end up in like the 2 sides, but rarer you end up in the middle, that's still a spectrum. It's not a uniform distribution along a spectrum. It's a bimodal distribution along, guess what? A spectrum. That's still a spectrum.
Male or female.
They were meaning to say there's no such thing as a sex spectrum, but then they acknowledge the existence of intersex people, which literally shows the existence of a sex spectrum. A bimodal distribution, so essentially, we'll pull up the chart for people that need to see it. Sex versus gender spectrum. This was produced by Scientific American. Essentially, it describes various intersex conditions and how they essentially form a spectrum from the typical biological female sex characteristics to the typical biological male sex characteristics, and how all these conditions form various shades of in-betweenness that forms a spectrum. And then a bimodal distribution would look like you have roughly half the population that's in kind of like the typical male category or mostly typically male, roughly 50% of the population that's in the typical female category or mostly typically female. This middle portion, the overlapping portion, those would be intersex conditions. That's literally the definition of a spectrum.
Sex is not assigned. It is an integral part of who we are, right from the moment of conception.
When people say that sex is assigned, there's 2 things that they're meaning. One is they're meaning that it's like designated on a birth certificate. as in doctors will take a look, they'll do a determination. That assignment might not be right because a baby could be intersex, for example, and the doctor didn't know that. So that is an assignment. And the other reason why people use the term assigned sex at birth is because, especially with many intersex people, they are physically operated on without their consent, intersex genital mutilation, to change their genitals to look more like one sex or the other. They are literally assigned by the doctor's knife at birth, irreversibly, in ways which are more likely to have complications than if they were allowed to just like naturally exist as they are. That's why that's why we use the phrase assigned. Just taking issue with language again, I guess.
This is true for horses, dolphins, and every other species in the animal kingdom.
Wait, they're trying to say that like, oh, sex is just simple and binary in every species of the animal kingdom. Clownfish literally change their sex out of necessity. Clownfish can change their sex in order to reproduce as either sex. It's fascinating. There are so many animals that have very unique abilities to change sex or really interesting ways that sex are determined. I know that also like lions, for example, it's even been observed that there are trans lions, as in there were like female lions that grew out like a male looking mane in order to take on the role of male lions in a herd that needed males. There are trans animals out there. And there are animals that are completely capable of changing their sex. To try to suggest that like sex in the animal kingdom is just simple is so far from reality.
It is also true for human beings. There is no such thing as gender-affirming care.
I guess they're saying that the trans dictionary is made up. There's no such thing as transgender. There's no such thing. Oh my goodness. Can we get a base gender abolitionist comrade? Can we get there's no such thing as gender? Can we come on?
You cannot affirm something that does not exist.
Hey! They did it! They said gender doesn't exist. We have a base gender abolitionist comrade. We need the Soviet Union anthem. Yeah. Thank you. Base gender abolitionist comrade. Gender does not exist. PragerU.